Hi friends, welcome to PharmaGrid. Nowadays we know that most of the pharmacy competitive exams like OPRA, then PBC, NAPLEX, GCC exams like MOH, DHA, HAT, PSI exam, all these kinds of exams have changed their pattern. And most of these exams, their pattern has included more and more clinical oriented or patient case related type of questions. So I hope this video discussion series or this clinical oriented patient case related question discussion series will be useful for all those who are preparing for any kind of pharmacy competitive exams. Okay, so let's start with today's first question. A 33-year-old pregnant woman begins taking a new drug X, for morning sickness. Drug X has not been found to have adverse maternal or fetal effects in animal models, but no human studies have been done. Under which FDA pregnancy category would drug X fall? We know that there are mainly 5 pregnancy categories, that is category A, B, C, D and X. And here we need to find out, here the patient or the pregnant woman takes a drug X for morning sickness, and this drug has not been found to have adverse maternal or fetal effects in animal models, but no human studies have been done. So this drug belongs to which pregnancy category? The options are A, B, C, D and X. So here the correct answer is option B. That is, here the drug belongs to pregnancy category B. Now let's see in detail what all are the pregnancy categories and their definition. Pregnancy category A contains drugs that have shown no risk to the fetus in the first trimester of pregnancy in well-controlled human studies. That is, category A drugs are commonly considered as safe drugs to use in pregnancy. Then category B is for drugs that have either had no well-controlled human studies but show no risk in animal studies, or drugs that show risk in animal studies but not in well-controlled human studies. Category C is for drugs that show risk in animal models and have had no well-controlled human studies. Category D is for drugs that are known to pose a risk to the fetus, but the benefits may outweigh the risks. Category X is for drugs absolutely contraindicated in pregnancy. Category X drugs pose such a great risk to the fetus that no benefit is seen to outweigh the risk. Moving on to the next question. A 56-year-old alcoholic male consumes a 6-pack of beer before going to bed. After being absorbed from his gut, blood carries the alcohol through the portal vein into the liver where it can be metabolized. Phase 1 metabolism of ethanol is carried out by cytochrome P450-2E1. Which of the following is true of phase 1 metabolism? We know that this metabolism consists of mainly two phases, that is phase 1 as well as phase 2, and here we need to find out the true statement about phase 1 metabolism. Now let's see the options. Always precedes phase 2 metabolism, are carried out largely in the plasma. Examples are oxidation and reduction reactions, includes reactions such as glucuronidation and sulfation, produces very polar metabolites. So here the true statement regarding phase 1 metabolism, or the correct answer is option C, that is, examples of phase 1 metabolism are oxidation and reduction reactions. As I have already mentioned, drug metabolism is grouped into two categories, phase 1 and phase 2. Phase 1 metabolism is carried out by cytochrome P450 enzymes in the liver and includes oxidation, reduction and hydrolysis reactions. The phase 2 metabolism conjugates the metabolite with a highly polar moiety to facilitate their excretion in the urine. Phase 1 is not a chronologic term. Often, phase 2 metabolism precedes phase 1. Now let's see why the remaining options are wrong. The option A, that is phase 2 metabolism, can precede phase 1 metabolism. Okay, so the option A is wrong. Then option B, most phase 1 reactions are carried out in the liver by the cytochrome P450 enzymes found in hepatocytes. Then option D, that is glucuronidation and sulfation, are examples of conjugation with polar moieties which describe phase 2 metabolism. Then option E, phase 1 metabolites are generally somewhat more polar than the starting compound, but not as highly polar as phase 2 metabolites. Okay, hence the answer came as option C. Question number 33. A 74-year-old man with moderate stage Alzheimer's disease is seeing his primary care physician. He takes various medications and all are prescription items. He has just begun on memantine 6 months ago and his family notes no difference in his symptoms. What is the most likely explanation for these findings? The options are drug toxicity, expected side effect profile, interaction with antacids, interaction with vitamins underlying tinnitus. Here the correct answer is option B, that is expected side effect profile. Memantine is well tolerated with few dose dependent adverse effects. Expected side effects such as confusion, agitation and restlessness are indistinguishable from the symptoms of Alzheimer's disease. Given its different mechanism of action and possible neuroprotective effects, memantine is often given in combination with an acetylcholinesterase inhibitor. Next one, a 72-year-old man is going to undergo a left hemicolectomy. The anesthesiologist is preparing to anesthetize him and plans to use inhalational anesthetic agents. Which of the following factors will make the patient require more anesthetic agent to achieve the desired response? The options are chronic alcohol abuse, diet, immunodeficiency state, hypothermia, weight. Here, the correct answer is option A, that is chronic alcohol abuse. So an explanation to this answer is given in this slide. The more lipid soluble an anesthetic, the lower the concentration of anesthetic needed to produce anesthesia, and thus the higher the potency of the anesthetic. Factors that can increase minimum alveolar concentration, which is denoted as MAC, that increase the minimum alveolar concentration means which makes the patient less sensitive. So such factors include hyperthermia, that is greater than 42 degrees Celsius, drugs that increase CNS catecholamines, and chronic ethanol abuse. Then diet, immunodeficiency state and weight will not affect minimum alveolar concentration. Question number 35. A 54-year-old man with insulin-dependent diabetes mellitus is treated with daily glargine. His blood sugars are typically in the range of 100 to 180 mg per deciliter. The rationale behind the use of this agent and its success as demonstrated in this patient involve which of the following? The options are degradation by gastric juice, low isoelectric point, hepatic metabolism, oral administration, renal excretion. So here the correct answer is option B, that is low isoelectric point. The isoelectric point of insulin glargine is lower than that of human insulin, leading to precipitation at the injection site and extending its action. It is slower in onset than NPH insulin and has a flat, prolonged hypoglycemic effect with no peak. Like other insulin, it must be given subcutaneously. Now let's see why the remaining options are wrong. Option A, degradation by gastric juice would prolong the hyperglycemic state and not treat this patient effectively. Then hepatic metabolism occurs with this agent, but this has nothing to do with its blood glucose lowering properties. And the option D and E are wrong because this insulin glargine is administered mainly through the subcutaneous route, and this agent is metabolized in the liver. Hence came the right answer as isoelectric point. So with this question we have completed today's question discussion series. Thank you everyone. Please like, share and subscribe. Have a great day.